Hello everyone, this is Tribeni.ghosh again. Today's session is about patient verification. The unit of competency MSL 40122 Certificate 4 course in Laboratory Techniques, Release 1. Before starting, I'd like to inform you all that the section will be recorded. I'd like to start by acknowledging the custodians of the land on which we gather on today. I'll pay my respects to their elders past, present, and emerging. I also like to acknowledge the people of Bangladesh nation from where I am today. Excuse me. Now for safety inspection, please make sure you maintain an ergonomic setup with your workstation device kept on a workstations, and please make sure your screen level is slightly below your eye levels. And if you have screen fatigue, please take frequency break from screens. And please make sure electrical stores are kept properly. And please make sure you are comfortable at where you are sitting, and you have enough ventilation and lighting systems. And most importantly, in case of any emergency, please always remember your safety first. Now, what is today's session about? Today's session will first learn about what is the importance of patients verification. Then we'll practice how we do the verify things at the laboratory. How do we verify patients? We do some role play, and I think after today's session, you will learn, you will be able to verify patients successfully at your workplace. Now, do you guys have any ideas why patient verification is important in healthcare practice?
I think it's important to identify your patient's name and address before you start taking samples, because some people might have the same name. And so I think it can be confusing if you collect different samples from different patients.
Yeah. Thank you, Suraya, for your wonderful answer. Yes, absolutely. Because if we don't verify our patients, like if we get two patients with same name, we can,
mix up the samples.
Yes, mix the samples so that the results and outcomes of that will be like catastrophic. Like yes. Sometimes it can be deadly. If you you are doing some blood test, which is for blood, for blood. You are doing blood test, and you did some. Like one patient is A positive, and another is O negative or something, and what will be the result? Just imagine that. So it's very important for us to verify first before collecting the samples, to verify patients correctly. So before start, I would like to show you some video how we do the whole process in the workplace. Please let me know if you can't hear sound properly.
How to greet a patient.
Is the sound okay?
Yes, the sound is okay.
See?
Yeah, it's all right. We can hear it.
To respect the patient's privacy, knock on the door before entering.
Hello, Miss Angelica. Yes, I'm Brittany. I'm going to be your medical assistant today.
Make eye contact when greeting the patient.
Can I have you verify your name? Angelica Lopez. Okay, your date of birth, August 14th.
Patient identification is extremely important. Please ask the patient to state their name as well as their date of birth.
Verify your name, please. It's ANGELICA MARQUEZ. Your date of birth, Okay, I'm going to get started on the model sign and I'm going to let the document begin. All right, thank you.
Alert the physician that the patient is ready by using a flag or light system.
Document your final step to success.
So, did you watch the video? Did you understand the process?
Yes, kind of.
Okay. For the better understanding, I thought it would be better if I show you some demo conversation. So I make a demo conversation for you, you guys. Can you see the conversation here?
Yes, we can.
Laboratory operator. We sort of like do this kind of, conversation at workplace. The question patterns is almost same. I think it will be helpful for you, both of you. And after that, we'll do some role play on the basis of this
Conversation.
conversation. Yes. So, what do you think? First, do you like Suraya and Oshi? Do you two practice it together, or you want me to practice with one of you, and then?
I think it would be better if you practice with us.
Okay, thank you. Let me do the lab operator part, and
Okay.
Suraya, as for Suraya, please play the patient's part.
Okay, all right.
Well, like the first
I'm
thing.
going to be the patient, right? So I'm going to
Yes.
speak first. Okay.
Yes.
Hi, I'm here for my blood test.
Great. Can I have your name and date of birth, please?
Of course. My name is Ummehani Sharif, and my date of birth is 25th May 2001.
Okay, thank you. Could you please spell your last name for me? Mrs.
It's
Raya?
Sharif. It's Sharif, Sharif.
Thank you. For the security purpose, could you please verify your address, please?
It's 13th B 112 Main Street, USA.
Excellent. Plastic, can you please confirm your mobile number? You know why?
It's-
Why do we ask for mobile number? When things like this happen, like you have same number, you kind of live in the same street, but you cannot have the same mobile number.
Same number, yes. Yes.
Basic thing you could ask your patients for their mobile number. So
My mobile number, should I share my mobile number now?
you just mimic. Tell us any number.
Okay.
For
Yes.
security purpose, right now,
Yes, of course.
my opinion, don't share your number.
Yes.
Just blah, 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 blah.
Okay. It's 551734647.
Thank you for verifying your information. Ms. Suraya will proceed for the blood test shortly. Thank you.
Okay, thank you.
Now, Vanshi, it's your part. Should we start?
Okay.
Okay.
Okay,
You
we
will
can.
do the same as Suraya. You will do the patient's part. I will do the lab operator.
Okay. I am here for the for my blood test.
Great. Can I have your name and date of birth, please?
Of course, I'm Faria Jannatuluiti and my date of birth is 24 July 2007. 24 July 2007.
Could you please spell your last name for me?
Of course, it's OISHI.
Oishi. Is this your family name or your nickname?
It's my nickname.
Oh, sorry, Miss Weishi, I need your family name.
Oh, it's Oishi also.
Okay, then. For the security purpose, could you please share your address?
Yeah, of course, it's 36 Block B, Baghulbari, West Purulia.
Thank you. And if you have no problem, could you please confirm your mobile number with us?
Yes, we can. It's 01300291376.
Okay, thank you so much. We'll proceed for your blood test shortly. Now, what I want you guys to do, like Suraya and Oishi, you now know that what kind of question we do ask for patients, and
Okay.
so I want you to know, you to practice a role play. Like Suraya, first you will act like a lab operator, and Oishi will be a patient, and then Oishi will be a lab operator, and
Okay.
Suraya will be a patient.
Okay.
Okay.
Should I go first?
It's up to you, and Oishi, of course.
Okay. First, I'm going to be like the lab operator, and Ushi can be the patient.
Yes. Okay.
Ushi, do
I
you want to
can
start
understand.
first?
No, I can understand.
Okay. Okay. Then
Okay.
how about
Oishi, should I open? Can you practice now? You can be the patient first. Suraya will be the lab operator, and you will be the patient. We'll do the whole process again. Today's session is all about just practicing, like how you ask your patients their information for verifying them. So what we'll do now, Suraya will first act as the lab operator, and she will ask you some questions for verifying you are the right patient or not. And then
the same question you just asked, right?
yeah, question pattern will be the same, but the answer is up to you. Okay, the main things we'll ask, like first we'll ask for their name and date of birth, and then we'll ask them to spell. Because sometimes what
The
happens,
last name.
even we have the same name, we don't spell it same way. So it's the safest way is like first ask them their their name, their date of birth, and then ask them to spell it. And when they spell their name, then ask them for their address. And when they tell you their address, you will ask them for their mobile number. Okay. And then, like, you are completely by doing this, you are completely, you are staying at the safe zone. Like you do the whole process, like there is no chance of
Making mistakes.
making mistakes. So, are you guys ready now? Do we do?
Yeah, we are.
Okay.
Do you want to play the patient first or the lab operator first?
Yes,
Do you want to play the role of a patient or the lab operator?
I want to do the role of patient.
Okay, then let's start. You are going to be the patient.
Hi, I am here for my blood test.
Great. Can I have your name and date of birth, please?
Sure, it's Oishi Faria Jannatul Oishi, and my date of birth is 24 July 2007.
Okay. Could you please spell your last name for me again?
Of course, it's Oishi.
Okay, thank you. Can you, for security purpose, can you please give us your address?
Yeah, it's 36 Block B, Bakulbari, West Burulia.
Excellent. Lastly, can you confirm your phone number, please?
Course, I can. It's 01300291376.
Okay, thank you for verifying your information.
You're
Ms.
welcome.
Oshi, we will shortly proceed with the blood test soon.
Okay.
Thank you.
Excellent, excellent job, guys. I think you, both of you, quite understand the process. What we are doing today, I think is quite understandable for you. Like you guys is okay with that. Now, Oshi, I like to request you, like,
Okay.
play
Now
the lab
I'm
part and
okay.
Okay, so I'm the patient now.
yes,
Yes.
So I'm going to start. Hi,
yes.
I'm here for my blood test.
Okay. Great. Can I have your name and date of birth, please?
Of course, my name is Ummehani Sharif and my date of birth is 25th May 2001.
Okay. Could you please spell your last name for me, please?
It's Sharif, Sharif.
Okay, great. Thank you for and security purpose. Could you verify your address?
Sure,
Could you
it's
please verify your address?
123. Yes, sure, it's 123 Main Street, Town, USA.
Excellent. Lastly, can I confirm your phone number?
Sure, it's 551234556.
Okay, thank you for verifying your information, Ms. Smith. We will proceed with the blood test shortly.
Excellent. Thank you so much for both of you. Thank you. Now the question part. Like from your practicing, I think you both of you know the process now. So I want to ask you just for my for my uh, satisfaction, like you guys catch the gist of today's session. Well, first,
Yes.
for verifying patients, is it important to ask patient to spell their name?
Of course, it is because the patients might have the same last name, but the spelling can be different.
Yeah, we agree.
Do we need to ask them their, spouse name or their father's name or mother's name?
Should I answer?
No,
I think it's important to ask them their spouse name or father's name if there are multiple patients with the same name. So their father's name or mother's name might be different. So it can help to verify the patient's name.
Yeah, in a way, Suraya, your answer is okay. But in my opinion, if you go through the protocol, it will be better. Like two patients can't have like, for verifying, we are asking 3 or 4 questions related to him or her, like their name, their first name, last name, their spelling of their name, their address, their mobile number. So
Okay.
I think if you go through the protocol, you don't need to ask
Further questions, right? Okay.
further questions. But yes, if confusion arises, still this, if you are like you are going through the protocol, but still there some confusion, then you can ask, but it's not mandatory to ask their
Okay.
spouse names or parents' name. Okay, and I think both of you ready for verifying your patients at the workplace. But now, do you guys have any questions for me? Like, is there anything you want to know regarding today's session?
I don't have any questions right now.
Okay, Oishi.
I don't have many questions too.
Okay. So our next session will be the how we maintain instruments and equipments in laboratory. Like it's very important. Like when you start your job in a laboratory, we usually assign like some do the sample collecting, some do work in the laboratory, some do as a transporting thing. If your assigned job is to do work in the laboratory, not the sample collecting or transporting the sample or something like this. If your job is to work on the laboratory, it's very important to maintain and organize your equipment. So our next session will be how we do maintain these things, how we do handle equipment in the laboratory. We'll learn about this in our next session. And as for today's session, we are finished for today's session. But I would like to ask you, please give me some feedback. I send you a feedback form through email, and please give me some feedback about today's session, how you like it or not, or where I can improve myself. Please give me some feedback, and see you on next session. Bye-bye. Thank you all. I appreciate your participation. Thank you very
Thank
much.
you very much.
Thank you too.
I'll stop the sharing now.
Okay.
কি করবো? Recording stop.
Recording stop হয় না?